So this topic, deeply important to me, and I'm not going to talk about data at all. So collective sigh of relief. Whew. No, very little, like IT, teeny bit, and hardly any data, so we can relax. All right, it'll be fun. Our industry is being disrupted at an incredibly rapid pace right now, and we're feeling every bit of that disruption. Those things are continuing to struggle with medical error, although we understood from the 1999 to Error is Human report that we were harming people in astronomical numbers. It was shocking to me. I mean, I could see it in my hospital system, here, there, and you'll learn a little bit more about my background in medical error. And yet we still struggle today with bringing those error rates down. We know that we've got new payment models. Now, I was talking last night to people at the reception, understanding that the new payment models haven't quite hit for you, but you can feel that tsunami impending. You know that it's on its way, and you know that it's going to bring profound disruption and change to your world, even as regulation has done so, and I could feel the weight, people talking about the regulation, more and more and more of it. New market entrants, we're going to talk about that for a moment, and some technology disruptors. Not a lot of time on this, but I really want to acknowledge what your milieu is like, what your world is like. So we know that we're still the third leading cause of death. That was absolutely shocking. Marty Macri did his report in 2016, a meta-analysis that told us, no, it's true. We've got definitive research now that says we're way up there. This is, no one is greedy or avaricious or evil and intends this, but one thing that I learned from traveling with the improvement guru, Dr. W. Edwards Deming, I was a student of his here and in Europe, and he talked about bad systems bringing out the worst in good people, and how the system design has so much to do with our ability to perform or not perform. We know that those new payment models are impending for you. I've got to say, I thought they were the panacea. I thought they were going to be the silver bullet, that suddenly we would care more deeply about working together, destroying silos, coming together in the name of the patient and safety. I've been, to say the least, disappointed in our progress on that so far, but I'm going to spend the rest of my life working on it. We know, too, that new market entrants are coming in, and if we are not thinking about the impact on this, we should be. So you can see that Apple has opened up a clinic. Here comes Apple into healthcare. So it's not just Apple with Apple Health and mobile sorts of things. They're moving into the care delivery system too. Optum is an example of where insurance companies used to be insurance companies. Now they're in care delivery. Care delivery companies are now moving into insurance. The lines are being blurred between all of these players. And think a little bit about the impact on this. You don't have to worry about the small print on this slide, but what I'd like you to see on this is that if you look to your left, you see here that there's the tiny little dots in terms of market capitalization. That's the relative financial power of these organizations. You see the tiny little dots are Magellan, Tenet, those over there. A little bit bigger when you see Anthem, Aetna, Cigna, Humana. You go a little further over there and you get to Walgreens and CVS. And of course, the big dot on here is United Healthcare. It sits right next to the Aetna-CVS merger, and below that, the Cigna and Express Scripts merger. Well, that's all fine and good. Take a look at these bigger entrants when they come in, though. They absolutely dwarf the size of those people that we think are the major players in our field right now. So you see that way over to your right is Apple. When Apple starts to move into this industry, we should take notice because they have a huge market capitalization. When we look at Alphabet, that's Google's parent, and we look at Microsoft, all of these, they're all entering healthcare right now. If we think this will not be an impact on our industry, we're wrong.